All right, we are officially live. Welcome, Robert. Welcome, Popier. Please say hello to everybody who's watching
No.
or watching
Hello.
the
Saying
recording.
hello.
So, okay, let's see here. Okay, so make that adjustment correct here. Okay, all right. So welcome everybody. Thank you so much for joining us. This episode 13 already. I can't believe it. I
Lucky
probably need
number.
a 2 weeks vacation, and then we're not going to do the podcast for 2 weeks, and then we're going to restart again. We just have to go back to our 13 honorary guests and ask them to refer one, at least one. So let's just go ahead and do a original announcement, and then here we go, and then okay, let's go. I'm going to need my glasses, but I'm going to do my best trying to read this. All right, here we go. It's time. 8:02. Here we go live weekly at 8:02 Standard Time. Sometimes we do Eastern Time, sometimes we do Hawaiian Time, and sometimes we do Pacific Time. Whatever ordinary guests wish to do, we're there and we're flexible. The Mindful Matter podcast. Follow, join, watch us where you can learn how and why the following successful, healthier, create generational wealth and money tree, and about all, how and why it is important to be happier with the people around you. Here we are moving forward to our episode 13. Okay. Please welcome our honorary guest, Robert Ung, founder at Robert Ung Health and Financial Education, pharmaceutical manager, and life producer. Robert is an extraordinary man with health and financial problem solver, genuine love for improving humanity and his community through his own Robert Ung Health and Financial Education and Lifestyle. He is kind, caring, motivator for many individuals to have better health, finance, knowledge, and understanding. Robert has been helping people on their path to a better health as a trust pharmaceuticist for over a decade, 2 decades, excuse me, decades. He has tremendous faith and hope in potential in each person. His vision is to see people get more out of life with his teaching. I'm sorry, I'm having a hard time seeing.
We can read that.
I know I'm having a hard time seeing a personal economic education, retirement supplement planning, tax saving, strategies, private reserve account. And here's our co-host, Bopir So. Sorry about that. I'm struggling with this vision right now. I should have had my glasses on. My apology, but I guess the lighting wasn't bright enough for me. All right, Robert, thank you so much and
Thank
welcome to
you.
our podcast. We're going to go ahead and prep you for the next six topic or six question. You're going to have about 45 minutes to answer those topic and question. And then Bopia and I would interact with you, make you feel as comfortable as possible. And like I said, you don't have to memorize anything. You don't have to read anything. Just go with the question and do just whatever come to your mind. And I'm sure you've been, you know, think about this a lot, and you shouldn't have any problem at all. Just
If you
relax
live
and
it,
have fun
yeah.
with this.
Yeah, you live
Yes,
it.
yes, just live the moment. Okay. So we're gonna go ahead and talk about. We're gonna ask you to introduce yourself. Tell us about Robert Ung, and then that, we're gonna ask you a few questions between those, and then we're gonna dive deep into your vision and businesses. And then we ask you to share your strategy on the personal and business success and challenges and obstacle. And then number four, we ask you to share your experience how to be and stay healthier from a mentally, physically, emotionally, spiritually, and financially. And then number 5, we ask you to share your methodology on why and how to build generational wealth and plan your own money tree. Give us some advice how you do that to make you financially stable. And above all, how and why it is important to be happier with the people around you and how to have a strong inner circle relationship. So, Bob, Robert, please, the stage is yours. Please talk about yourself. Who is Robert Ung?
Yep, so
Please.
I'm just a simple guy, simple family guy. I was born in Khet Kadal, Khmer, Cambodia, and lived through the genocide and went to the refugee camp and got sponsored to America. And we came to the United States in 1982 and went schooling there and happily married now and with 5 kids, 5 boys. And I've been working as a pharmacist all my professional life. So right now I'm living in Harrisburg. I've been living in New York City for over 20 years, and then I moved here in Harrisburg 2002.
So,
I'm here now.
so what was the process of you coming to America? You said you live in Kawidang, or is it one of those?
Yes, Kawidang refugee camp. I lived there, and then we would put our name out there and looking for sponsor all over the world, and then they would ask us, where would you want to go? And we didn't know. I don't know anything, so we just whatever we heard, the city, we say, oh, New York, oh, that's a famous city, so we want to go to New York. That's where we end up.
So when did you arrive in the camp? And how old were you when you arrived to the camp? Would you come with your mom, your dad, your relative?
It was a tough time. We were staying in the border inside Cambodia, and then there were fighting there, and that's how we hop on the UN truck. The truck, they come to the jungle to look for people who wants to go. So we jump on the truck, and then we came to the refugee camp together.
Wait a minute, you got a ride from the border to the refugee camp?
In the jungle, yes.
Are you kidding me? I didn't know such thing would happen that way, because I got to walk 5 days and I'm only 7 years old.
Oh, that was a truck.
Are you kidding me?
Yeah, in the fighting.
My gosh. Lucky you.
I was on a ox cart, and then I walked barefooted, but then I got some of my uncles help carry me, help my father. So I was little.
Well, you were what, a baby? You were like 2 or 3.
I was like a toddler.
Yeah, you're tall. You're not gonna. Yeah, I have to carry a lot of things because my brothers were sick and I was 7. I was the one that's healthy and carry everything I could carry. And then, his wife had a baby, so she carried her, and he couldn't carry anything. He barely can carry himself. So yeah, we took a risk to go down that jungle. I mean, it's an amazing story. It's an amazing experience. What was the dangerous risk that we took? That was crazy, isn't it?
Yeah,
we see dead people on the road. Yeah.
Back then, let's say when I got pricked by, was it me or my sister? I can't remember. But we use chai to wrap to heal the nail. So when you came along, did you find any injuries? Did you have any injuries that you find that they're medicinal out there to help heal it?
No, when I came there, I didn't get injury. My family didn't get injury, but we saw dead people on the road. It's so sad. People get their limbs cut off and stuff. The
Okay.
mines, because of the mines, you know.
The landmine. Mhm.
The
Yeah,
landmines, yeah.
what a horrible experience, isn't Robert?
Oh,
And how old were you when you
I think maybe 12, maybe
so
12.
you were 12, you
Yeah,
were like that's an age that you was curious and very skilled, very brave.
yeah,
Mhm.
yeah.
A little bit of everything, right?
Mhm.
Yeah, yeah. I lived through a lot,
Mhm.
Wow.
but it's a
Wow.
blessing. It's a blessing.
Mhm.
We're gonna well the good news is all of us gonna share our story through Kabami.
Yes,
So you know you're gonna get involved a lot with the storytelling, with the Kabami TV and with the music, with the short story. So you know we're not gonna get stuck in this surviving mode anymore, Bong. We're gonna
yes,
start living our life. You know,
yes,
yeah,
yes,
we're gonna start living our life. We're gonna start to rise. We're gonna start to conquer. This generation and generation up here, which is telling me the good news that you know Cambodian are full of youngster.
yes,
That would be generation that would, if we go back there and help them and really prep them how to appreciate our ancestor, what they done, what they have done, what they have built. You know, this is a pride, this unforgettable pride. We can actually rebuild, you know, what we have, what our ancestor has started, and you know, so you know, I have so much faith that it's going to happen again. You know, having your experience, sharing your story, because your
it's
story is
it,
going to have a critical impact on the young generation. So I'm hoping that you're going to share your story.
Mhm.
So as often as you can,
So,
I think this one of this
so
podcast is a great way.
when you're in Khao Ai Dang, did you go school there?
I went to school there. Yes, my class maybe Ong Tang. You know, like I think they go backward 12, and then
Uh-huh.
11 and 10.
Yeah.
I think I was second grade.
Oh, that's pretty high.
Yeah, second
That's
grade.
like 11th grade
Uh,
here.
yeah, but they got count backward. The first
Yeah.
is a 12th grader. That's 12th grader. It's the first grade, and then the 11th grade is second grade. So I
Oh,
was
Yeah.
11.
Yeah. And then your second, so it's 11th grade in the US.
No, no, no. Second
No?
grade in the US.
Oh, okay.
You go backward. Yeah,
So
go
you're
backward.
11th grade over there.
Yes, 11, which is second grade here.
Oh, okay, okay. I got them switched. Okay.
Yeah, to go
Mhm.
backward.
That's okay.
did you learn Khmer language, or
I learned
did they
Khmer
teach
over
you
there.
English? You learn
No,
Khmer?
only Khmer, only Khmer. Yeah,
Only Khmer.
only Khmer.
Nice, very
So I
nice,
came here. I learned English in Brooklyn. Yeah.
sweet, sweet.
Yeah.
So, well,
Mhm.
thank you so much for sharing your story. We'd like to learn more about your personal vision of once you gain this experience. What is it like being an adult? You know, what do you want? What do you envision accomplishing from a personal perspective? What motivate you to, and then also share about your business vision as well? Because I know you become a successful father, a successful business person, a pharmaceuticist. I can't say that word,
A
pharmaceuticist,
pharmacist.
Pharmacist. Pharmacist.
pharmacist. Yes, and then this life coaching
People call
education.
me druggist.
Oh, okay. We
Drunkest.
were laughing jokingly earlier that you're on a
Legal drug
legal
dealer.
drug dealer. Yes.
I have a cold, so what should I take?
Oh,
So tell us about that.
Coke Chow is the best.
Gokchao, yeah,
Okay.
I like gokchao, yeah. I still do gokchao.
Me too. Yeah.
So just go ahead, tell us about through your experience, you know, what you're envisioning from a personal perspective, from a business perspective, to make you a man what you are today.
Well, my father died. I was pretty young. I think I was 9 years old. It's like not too long into the communism, so he starved himself to death. He said, "I don't want to live under this regime," so he starved himself to death. But whatever period of time that I had lived with him, he influenced me a lot. He always he taught us to go higher, to achieve higher. The usual, I think, the education, uh, to go higher education, to not be to be ashamed, to not be ashamed of where your position is. So that drilled in me to always look for more, always look for more. Never, I'm happy where I am, but not satisfied at where I am. It's always look for more, look for more. So my father is a big influence on me,
Mm-hmm.
and I try to install that with my kids, but kids nowadays, uh, it's like within me to look for more. And
Yeah, that's wonderful.
and
That's
because of
important,
that,
that motivation.
yeah, because of that, I also see people. I always see people that they can be more also, they can be more. That's why I always believe in people. I believe in people, even though when they prove me wrong, there is the timing. I mean, maybe it's the wrong timing. Maybe tomorrow we together can achieve better. Just like what you say, together we can do more, better, with your program.
Yes, no doubt, no doubt.
Yeah.
And having you and believing in the vision is critical important.
Oh yeah.
So from a business perspective, and I know you have this Robert Ung health and finance education. What are you doing with that on top of what you're doing being a pharmacist?
Okay. I've been a pharmacist for a while, over 20 years, and I witnessed a lot of people. They disease. Okay, when I came to United States, I thought of what do I want to pursue. During the 80s, everybody looking for computer science, but for me, I was like, what do I want to do? What do I want to solve? And is it you being with the law, you doing starvation? And I thought about it, and I said that the most devastating human problem is sickness. So I was interested in medicine, was going to go for 7 years BS PharmD, which is a BS and a MD degree, but no money, no language. So I settled for pharmacist because I don't have to know how to say, okay, you have a headache. When you have a headache. So I just want to know what to use for the headache. That's why I became a pharmacist. I became a pharmacist and that to help people that way, especially my own family, like that. And then I work in pharmacy for a long time, retail pharmacy especially. I see the people, they in and out of the, there are tons and tons of drugs are being dispensed and giving out, but nobody's getting better. Nobody's getting better. They just even not even maintain, but deteriorating in life. Like the Khmer has a pona, down choose a pona. We are ngurpa, we a pona, chivut jing a pona. Your life is stooping.
Mm-hmm.
So I said, sometimes the drug is expensive, they can't afford it. And then I realized that sickness, health is not the only issue, but also money is the issue too. Money, it goes hand in hand. And then I start educating myself on money, and I start helping people, with money, how to have a what they call a personal economic models, to have a better strategy. Don't just live day by day, but you actually have a plan where you want to go, where you go. So I train a lot of pharmacists. When they come in, I would ask them, why do you work? They tell me, for the betterment, this betterment and that. I said, no, the reason you work is because so that you can stop working sooner. Because if you have $1 million, a gazillion dollars now, would you do what you're doing? No, you wouldn't. So the reason you work is so that you can stop working sooner, working for money sooner. And if you ask that question, then what are you doing now so that you can stop working for money sooner? When I grew up, I have nobody, no mentor, no nothing. That's why I get where I am today, you know. So I help them with like 401k, employee stock purchase plan, HSA, to put their, don't just work for money, for the salary, but work so that you also have this. So I help them with that, help with the fringe benefits. I just want to give them an idea, say you work, you have to work smarter. And the drudgery of the work of slavery. But if you have all these accounts set up and you're funding them from your work, then you kind of feel better. Say I'm working to fund my account, not actually to just slavery, but this account, like that. So that's what drive me into the financial part of from pharmacy to finance.
So not only people are struggling with their health, but they also have financial problem because they don't know or understand anything about money and how to save up, how to, to be in a better position with their money because they don't know how to use it correctly.
Right.
Is that what you're saying?
Yes, I think the reason is people are nonchalant about it. They don't take, they either unaware of, well, there's something's not in them to awaken them, to say, okay, this, you got to think about this, and I'm very passionate, especially with young people, because they, one of the most tragic thing in life is missed opportunity. And I have missed my own opportunity. I don't want them to go through that missed opportunity. You know what I mean? So I have to be the one who tell them, hey, look, again and again and again, until they do something about it, and some of them, they do something about it. I'm very happy. So it's not about money to me. It's just about, if you get it, this thing right here, I'm happy for you,
So one can come to you and learn. What are some of the things they can learn from you? Like maybe a list of things they can learn. So if they seek any financial education, what would the top 5 things or top 4, top 3 things you'll be teaching them?
Well, the one of the things that I already said is, why do you work? To stop working for money, not to stop working. You can work all you want the things you love, but not for money. And that way you have the freedom to decide this policy is wrong. So if you tie to that job, and you cannot lose that job, you're going to do what they tell you, but if you don't, then you can argue back and say, this is the wrong policy, like that. So if they come to me and say, for the money, I would ask them, first thing is, what is the first thing? What is the first thing that you do to the things you have or your possession? What do? You protect it. You have to protect it. That's the first thing you do, is you protect it, and also, people don't have a lot of money to save. People have maybe a month, maybe 500, 300. But you have all these places to save. I got to go for college, kids' college. I got to go to, what they call that thing, emergency fund. I got to go to my retirement. I got to save for my car. Where do you put this $500 that get the most benefits or hit all that goals that you have? Where can you put it? Because it will be very thin, very small to put here, 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 here. But what if you can strengthen your money, put in one place, but it can serve all that, the most advantageous place to put, like that. And there are, a long time ago, we don't have too many financial vehicles that do this. But nowadays, innovations and loosen of the laws allow us to have this kind of products, this kind of product. Like, for example, Roth IRA is only 1998. It's very not long ago. 1980, you wouldn't have it.
That's right.
Yeah.
And it's always new invention, new method, new operation.
Like, for example, I was gung-ho for 401k, but now we found out that 401k is a death trap. It's not great because
I
the
see.
tax, the tax law will expire 2026, and because of the situation we have in the United States right now, do you think the tax going to go up or down? Absolutely, it's going to go up, right? So now we put in 401k tax defer, so we actually deferring to paying less tax to pay more tax.
Yes.
You can't trust anybody, especially somebody out there. You got to go out there and educate yourself, like that.
I see.
They have to pick your pocket somehow, right?
Oh yeah, somehow. But they also, allow us to do things that is beneficial to us, advantageous to us. But we have to go out there and be diligent about it. We cannot just wait for somebody to come, okay, here, do this. We got. I spend a lot of time researching stuff.
So you're the man to go to if they need to learn the
learn
finance situation, what to do with their money then.
Yeah.
So.
Or what to do with their life and business.
And health too, right?
Health. Yeah. So, with the health part, I do two things, okay? Three things. One is pharmacy, one is the finance, one is the health. Now, with this health, the pharmaceutical company, the drug company, the supplemental company put all the ingredient to your body. Okay, let's say you get a sick. Okay, these are ingredients to help you. But what if your body don't know how to use that ingredient? This ingredient is good, but I can't use it. You can pour gasoline all into your truck, but if your truck is not cranking, it's not going anywhere. But the product that I'm promoting is the one that helps the body to work better. So it's not from nutrition or ingredients, but it's actually helping your body to use the ingredient that's available already. Like that.
Well, I also have to understand, I think if you carefully think about what's going on with the pharmaceuticals or doctor or hospital, they're there not to heal you, but they're there to put bandage on you, to make you feel good temporarily. So I think from my own experience, from my own understanding and my own, I said assumption, but I don't think that they're to heal you, but just to make you feel good so that you don't suffer from the pain, from whatever you're going through. So I don't know if everybody changed their mentality and changed their mission to say, look, I'm here to heal, to solve your problem for you, and so that those things disappear, then they no longer be in business. So they're basically hurting themselves. If that's you're going against your own, you're basically putting yourself to death. I think so. I do understand. Sometimes I do that, but
yeah. Well, I think. Go ahead.
Well, 50-50. They're there. Sometimes they give you painkiller to help, but then you got this old age that you can't get away from, or death you can't get away from. Not even a doctor can help. Not even medicine can help. So they can help you prolong your age and your health, but to help overall, there's no doctor can help. Not in this world. There's no such thing. And there's no medicine to help you live forever and ever either. So so that's why I said it's 50-50.
So you say you're promoting the products, and what's the products different from what we have now? What's so unique?
It depends on products. Like for example, I'm gonna take an easy one. People that need to sleep. Of course, we need 8 hours of sleep. To help with our mind rejuvenate. But then people need medication to help them sleep. But if they don't get it, then it's really hard. It's just way difficult for them to fall asleep. So they need that medicine. So it is helpful. and the doctor not there just to collect your money to help. They really want to help. That's why they're there. There's a lot of doctors that really want to help people, sleep better. Just
Yeah,
using
but
sleep as an example.
I think the doctors are losing control of their autonomy, of their profession because of the insurance dictate.
Of what they could not do, right?
Yeah, could not do. And then you see how many patients you see. There are
Yeah.
the quotas you have to meet.
Yeah, like some medication for diabetes, some insurance cover, some don't cover. Depend on the brand too. Some cover brand name, some generic. They cannot afford to cover brand name. So this is all in a circle. You can't really blame on the doctor. You're right. It's all of everything. They gotta get their, like I said, pick their, get their a piece of pie somehow.
Right.
So yeah, the insurance play a role in it too. Medicine factory. They play a role into the doctor who, let's say, hey, I like this product better. I must prescribe this product for my patient. That product, that pill doesn't work for, certain patient, but it might work for me. It might not work for you. So it takes a really good doctor to know, the patient very well.
Yes.
To know their body well. When we talk about, we all have different body, let's say even color, even let's say, you're white, your body is different. We're Asian, Cambodian, our body is different. We cannot use the same medicine for diabetes.
When we take alcohol, we turn red fast.
Well,
we have different chemical, different enzymes and all that stuff.
So there's more to it of depending on the situation, depending on
so can't just blame
genetically too.
Yeah.
Right?
There's a lot into everything. Yeah.
So Rob, can you tell us a little bit? I know you spoke briefly about, you'll say something about the product you're promoting that would also help from what the doctor is doing, or even more better than what the doctors are doing. Tell us about that product you're promoting.
Well, the product that I'm promoting is called cell single molecules, redox cell signaling molecule. It's help the cell to communicate with each other. For every decade of our life, there's about 10% decrease in production in the body. That's why when you're young, you cut and you got healed the next day. Okay. But you get older, you don't heal as fast because of this communication is being sluggish, becoming slow. So this molecule replenishes that. The founder is amazing. He retired from very successful strategist for successful company, and then they hire him to come and help their company to run better. But when he and his son go into help, he saw this failing company, and they said, okay, can I buy the product? So they bought the company, and the failing company, and about 19 years later of research, again and again and again and again, this cell signaling molecules scientifically is impossible to make outside the body because it is fleeting. If you make it, it destroyed by itself, right? Fleeting, very unstable. So after 19 years, can you imagine 90 years of research into it? They finally able to stabilize it and to be able to use as a supplement and as a topical gel. And
okay. So they're finding something to make us younger, right? 20 years younger. That's what I need.
Yes, because it's anti-aging, because now the cell are communicate. It tells, okay, if you have no communication, you it's not functional. It's functional.
And what type of tech? It sounds, well, first of all, it sounds so impressive. It's amazing. I mean, if somebody able to do something like that, I think that's just a life-changing. I mean, oh my gosh! I mean, that changed the whole world.
It's a breakthrough.
It's a breakthrough, and do they did they have to go through like the FDA approval? Did they have to go through a lot of, restriction? How did they prove what that amazing discovery? I mean, is there certain thing they have to go through all that to just to make sure that when people are in question of validation,
Okay.
do they have anything to back that up? Or because it's so amazing, if that is the case, and you get approved by the FDA and you get approved by the doctor, can you imagine that you can completely change the whole world upside down, and just the health industry will change tremendously? I hope they have something like that already.
Well, so at the beginning, what he wants to do was to just sell it to a pharmaceutical company and walk away with the profit. But then the founder decided not to, because this belonged to the people. What they do, the pharmaceutical company will do with it, you know. So they said to the people, so they tested about 40, 100 people, and then to 120 people, and then all over the world, different parts of the world. And these people, feel better from this. So now, this is between me and you. I don't know if it's true or not, but the reason they label it as a supplement, because that get away from
I heard
scrutiny.
about that.
Yeah, from scrutiny, from the
Like
government in
herbal.
their hand. Less stringent.
Herbal
Supplement.
or what is it? Say cái
Supplement.
supplement. Yes.
Yeah,
Like
supplement.
vitamin. Yeah.
Yes. Not a drug. Not a drug. Not a drug. So it's this, my opinion. I think that's their thinking too. So you escape all that FDA approval and all that stuff. However, the facility that they make the drug, not the drug, the supplement, is approved by the FDA and another agency, which I forgot what it was. There's a lot of approval required. The process of making this stuff, they like seven layer of patents. 7 layers. Can you believe that? 7 layers. A bunch of other ingredients, patents. And let's say that they can do all that. It might not be true, because they can still lie. But then there is a third party, independent party, that they did the test. They did the test. Independent body, genetic labs, biochemistry lab, labs that those and other drug companies that send their product to. These companies send their product to those labs, to those labs, and then they test it, and they came back say, yes, this in fact, these molecules are in this product, like that. That's one layer. The other layer is that there are thousands of people, hundreds of people who has condition. I am one of them, chronic Lyme disease. My life was dying. And then when the Bong Sapon showed me this thing, I say, I'm a pharmacist. I don't know this stuff, but she was persistent. And then I say, okay, I'm dying. I'll try anything. So I tried it. Within 3 days, I got my life back within 3 days. Because chronic Lyme, you droop, you got aches and pains, cloudiness of the mind. And in the middle of the night, you got your heart, your chest. It's not your heart. I don't know where it is, but it's in pain, sharp pain, like that. Now I don't have those anymore.
Wow. A real life testimony.
Yes, real life testimony. So not that my testimony is approving it, but but it works for many other people, but it's strengthened my position.
So this product, is it available to anybody, or is it available in the store? Is it available through any? I mean, how is it available, and how people can actually get to it?
So
how many people have taken and proving seriously like have this real life testimony, because I think you said FDA already been approved, right?
FDA approved their facility that make
The facility, but really
the
not the
facility.
product.
They don't,
But not the
because
products, not the
the
supplement.
product, they don't have a hand on it because it's
So
a supplement.
how long does supplement have been created so far? How long?
Research about 19 years, in existence about 10.
So
10
after
years.
10 years, what's holding you guys back for getting approval from the FDA? Because if you just get that obstacle out of the way, can you imagine if what
No.
the
No,
FDA,
they don't want to go through the
no, they
FDA
don't want to go
approval. They
there.
don't want it to,
FDA is an
uh,
obstacle.
yeah. They don't want to sell it through, let's say, the hospital, the doctor
Yeah.
prescribe it. They don't want the doctor to prescribe it. They want to sell it as a
supplement.
like supplement.
No, I'm talking about from a people's personality, because you have to understand people go through a lot and people are always in question
Yes.
of validation of the products. So that's why they need something to. So I'm trying to go directly to that point, to that peak of success. So how do we remove that? If this product is so amazing, why can your team and the founders team get that obstacle out of the way, remove it so that people don't have that doubt or concern?
It's a question of selling the product. How do you sell it?
So number one, this product is we are not looking to, we're looking to help people, people who really sick and who looking for alternative. No, the mainstream, they can have the mainstream, but we're looking for people who say, okay, I have enough of this mainstream. Where is there anything else out there? So we can step up like that. And just because of the FDA approval doesn't mean it's safe. You know how many drugs kill people? You know how many drugs that come out in the market and take back out? Every day.
Getting recalled,
recalls and everything. FDA is like, for example, vaccine. I don't want to go in there, but
Pfizer.
you know who the head of the FDA is? The retired CEO of the manufacturer. You know what I mean? They are.
Oh yeah, cái ở thứ năm cái pass.
Yeah. So when Novartis guy get retired, then he go to NIH, he go to FDA to work, like that. Anyway,
anh đang approve ថ្នាំខ្លួនឯងអាហ្នឹង
right.
So after 10 years,
conflict of interest.
How many customer base, how big is the customer base right now? And what are some of the positive and negative feedback on this product supplement? Because like you're the positive one, but do you have any negative one?
Negative one, I have not heard. The only complaint I hear people say is it costs too much. When I first saw it, I say this costs too little, because I see the value of it. But most people say it costs too much.
And how it's being sold? I mean, is it in a bottle? Is it in a box? Is it in a milk cart?
It comes in. It comes in different. This is the bottle you drink.
So okay, so how big is that? Is that 16 ounce?
This normally, I think this one is. Oh man, I can't read that.
12 ounce.
32 foot ounce.
32.
Yeah.
32 ounce. Okay.
Ounce. Yeah.
That's a lot. That's a big one. That's a big one.
10 man.
So how much is for 32 ounce?
I just asked him that question in Khmer.
So, and then it comes in a cup like this.
Oh.
And this is about 60 ml. You drink in the if you're 50 years old or older, you drink 2 of this in the morning, 2 of this at night. So this is lasts a week.
How much will it cost in that 32?
It come like this. This is a pouch where you can travel. 32. This is about $40
So you spend about $40 weekly.
a
per
weekly
week.
per week. That's
Per
why
week.
most people complain about that much.
Okay.
Yeah,
And then
sarap
how
cha it is
long
expensive for them.
Yes.
how
Cha.
long do you have to drink to maintain it? Is it like does it have side effect? Like if I don't drink it, would I have a withdrawal? Like I
No.
gotta have it.
No. It's not addictive.
So I can
It's
stop
not like
at any time.
alcohol.
So
not
I can
like
stop
alcohol.
at any time. I don't
You
have
can
any
stop
withdrawal.
anytime.
I don't have any
Yeah.
like I got an urge to have it, like an addiction or anything like that. Does it have
No,
something
no.
like that, or is it that good?
You can try for yourself. It works for me.
Okay.
And they
No more
also
cocktail.
they have studies. They have studies. Topical. They have studies. You can study with mice. Study with athletes and Olympians. I'm talking about gold medal Olympians that use this, and they have testimony from them. That use that. So is different because it helps the body work. It's not just pouring gasoline into the engine, but actually making the car runs more efficiently. It's different. It's one of a kind in the world.
So it is a molecule.
Yes. They call it a cell signaling molecule. It signals.
What is the three main ingredient?
Three main ingredients. Actually, there are 4 molecules. Made of 4 molecules. So chloride, sodium, oxygen, and hydrogen.
Ooh,
yeah,
chemistry. You gotta understand chemistry now.
Yeah, that's it.
That's
all.
it.
But they
Wow.
rearrange it.
We can produce that. Not a problem.
But it has to be a certain way,
You'll play around with it. Han lakray. Lakray. It's
Hey, Bong, we can make our own
medicinal
hot sauce.
too.
We can make our own molecule drink under Kabami, right, Bong?
Yeah. By the way, I'm waiting for your beef jerky. After the first time I was on your podcast and you told me about beef jerky.
Did you call? I can give Bong Tali. I can give Bong
her
Tali's
jerky
phone number
is
to you,
so
Bong.
good.
I was
Oh my God, she's the best.
It's so good. I'm gonna order again. I'm gonna order.
Well, the thing is, she keep telling me, Chris, I don't want to make any more until you get everything validated. You get everything, the packaging, the description, the nutrition facts, everything the website's done. Once that is done, she don't even want to make it. She can't wait to pass it on to the restaurant so she can teach them how to make it at a restaurant. And every restaurant, we're going to accept 5 restaurants to order from them. So only 10 restaurants allowed to make it, but it will be 50 restaurants will be ordering from them all across the United States. So, and Bong Tali is willing to say, look, I want to share this with my restaurant. I want to share. All they do is sign a 3 years contract agreement that they're not allowed to make any beef jerky outside what she's teaching them or get involved with any type of beef jerky. If they sign a 3-year contract, that's it. Yeah, if you have a restaurant and you want to do this, Bong, and then we'll do everything for you. And then we just pay you what the cost is that you charge us, and then we split the money with the 5 restaurants that's selling your products, and then local customer can just pick it up, or you can actually sell it online. I'm excited.
I have exclusive right to sell it in a gas station.
Oh, there you go.
Oh,
yes.
okay.
Yes.
Gas station love sheets.
Yes, indeed. Yes. Yeah. So like I said, we're not gonna approach that yet. The reason that we don't want to do that is it's the expense that we have, and plus I think the most golden jerky, the jerky is happening now is, what is that? Jack Link, right? Is it Jack Link? But they're selling it's $19 for 16 ounces.
Yes.
And we're selling us at like 45 to 50 because it's that good. Yeah, we're gonna have ankle crown packaging. We're gonna have like souvenir from Khmer souvenir in there. you name it, and then we have a special packaging that you have. It's like $200, $300 packaging that you spend, but it's a gift that you purchase for somebody, a
Oh,
special
yes,
occasion.
that's good.
And then you have a
Yeah.
4-ounce where somebody say, I want to sample it. Okay, we'll give you a little taste. And now you're gonna say, I can't wait to get more.
You know how the sales go to Christmas time?
Yes, and that's why I was talking about the package company, how we're gonna design with our brand director of what can we do with our history of what can we include in the package to make it valuable, make it meaningful. So I can't wait.
Yeah.
So anyway, this is about you, Bong. So let's we're only on number 2, and we have so much only little time left.
I
So
gotta
go
work
ahead and
tomorrow.
let's talk about your
I gotta work
strategy.
tomorrow.
Let's talk about your business success. Talk about your challenges and your obstacle. I know you talk about a lot of success as of now, but what are some of your challenges with your health education, with your finance education, and your this amazing product that you're promoting? What are some of your challenges and your obstacle, Bong?
Challenges for me. Challenges is time, number one, because I work as a pharmacy manager. It's very busy. And the other one is technology. I'm not good with technology. I don't even know how to Zoom. If you send me a link,
you did fine with this, right?
if you send me a link, I can click it. But for me to set it up, maybe not.
We'll take care of it, Bong. Whatever you need to know, just
like
contact it. We'll help you.
And I think my goal is to it's going to be slow for me, because you have to, if you want to be scalable, you got to do with technology like this. But for me, it's just word of mouth, word of mouth, one person at a time. I talk to everybody I come into contact with. Hey, you want to know about what is your problem? How about you want to try this? So I just talk, referring. That's it. I try to do Facebook and stuff, but I'm very not good at that.
Yeah, like I said, if the next question I want to ask you is that since the product is so good, how does it benefit to the athlete like myself? I love sport. I'm very active in sport. And how does your products does it have potential to help athletes?
Oh, yes. What's good about this thing is this. With the financial business, I have to go out there and explain to people. But for this product, I don't explain to people. I just send them links to look at, So in the sport world, which I don't know too much of it, but they talk about time to recover, improve time to recover. I don't know what that is, but when when you do the lift up, you got to relax like 2-3 days. You don't just do it every day. But this stuff, right? Time to recover, stamina. The endurance is better. This is some of the stuff I remember. They talk about.
Well, I'm definitely interested, to be honest with you. And then if everything is meet and exceed my expectation, I probably could help, and even have my own website that all I do is promote that particular products, and then all information. And I do video production. I would do podcasting, just talk about this product, how amazing it is, and not just talking about how amazing it is, but actually proof that it's not a hype. This is something that is genuine.
Yes.
That it's helpful, and it's healthy, beneficial, from the mental, from physical, and look like if you take it, if it's a molecule, it help you in all aspects of those mental stage, from the physical stage and emotional state, because it's all interconnected, right?
It's all interconnected. Yes.
Yeah, because I could see that, because that's why I asked so many questions, Bong. Because if it's legit, I could definitely be part of it as well.
Yes.
But I'm also a very skeptical person.
I
I
understand.
like to challenge. I ask question, and sometimes my question can be very offensive.
Oh no, it's good.
But I try to, like I said, I try my best to be as professional as possible. But I'm also a believer too. If you prove to me that this is an amazing product and it works and it's genuine, straightforward, and it's beneficial to a lot of people, then yes, I would not hesitate. But
Yeah.
I'm not the type of person don't like to watch. I like to take action.
No,
So the reason I like to take action because I ask a lot of questions and I get
yeah.
the answer I want. That's when I start really support you. So believe
Well,
me,
yeah.
yeah.
The key is in the questions. You ask the right
Yes, and
questions.
that's why
It's
I
not
ask a
the key
lot of
is in the
questions.
questions.
I am
Uh,
so annoying sometimes with my question.
oh,
I
that's
even
good.
annoy myself sometimes.
You ask the right question, you'll be successful.
Yes,
Uh,
indeed, indeed.
Before I took this product, I took doxycycline and amoxicillin every day,
Wow.
switching. And this thing kills you, because it killed the gut bacteria.
Yep.
Right.
It's not very good. It's not
Taking
very
that too
good.
much is not good.
Every day, and it doesn't go anywhere. Most people, about only 20% of the people who get Lyme disease become chronic Lyme disease. But the rest, the 80%, will get well with just one course of amoxicillin or doxycycline. Okay, my sister got it too, and she got late, and then she got to have IV or Cephin, which is some kind of amoxicillin, for a month, and she
Wow.
got rid of it. I heard story where the surgeon I saw on YouTube once, he's a surgeon, he's a doctor, a surgeon, he lost his heart because of that misdiagnosis, because the mainstream medical people do not recognize, the insurance do not recognize Lyme disease. They do not.
Because it doesn't benefit them. That's why.
Yes, you are correct.
Why would they support you if it doesn't benefit them, right?
Yeah, too little, too small.
Too much too much politics too as
Too much
well.
politics, yes.
Yeah, so I guess in a way it is. I do have that question as well. On both ends.
Yes.
I'm not biased.
You're open-minded,
Yes, I'm a very
Yeah.
open-minded. You can see, yes.
Yeah.
So because, like I said, my goal is to bring people together. If you don't have open mind, then that gate will not be open.
Yeah.
So let's go ahead and move to share your experience how to be and stay healthier mentally. So how do you keep yourself healthy from a mentally, physically, emotionally, spiritually, and financially, Bob? Can you share that experience with us? Share your experience how to be and stay healthier mentally, physically, emotionally, spiritually, and financially. I know you touch base how things help. So, you can say it differently. You can say it.
Well,
So you did talk a lot about those, and I get that already. So, but if you want to, touch base on that, just to when somebody's listening to you, just tune in right now. They never heard about it yet. Go for it. Tell us about how do you stay healthier mentally, physically, emotionally, spiritually, financially. You can do it on a personal basis, or you based on what you encounter.
I think the number one ingredient for health is happiness. You have to stay joyful. You have to be joyful. I'm a very playful person. I'm a very playful person. I don't think I ever grown up. Size-wise and mind-wise, I'm very playful. I think playful is an ingredient for good health. You have to do that. And I went to class and they talk about fat and the weight and this and that. And what the conclusion of what the presenter over and over again tell me was that fat gain is through the mouth. It's you gotta be careful what you eat and when you eat. It's like you eat and then go to sleep and go to your belly. Your belly, because I witnessed that with night pharmacists. Night pharmacists, they eat at night, and a few years later their belly start growing. Night pharmacists.
I saw beer would do that to you, right? Drink a lot of beer.
Yeah,
Six-pack, is that what you call it? Six-pack, right?
And if you really want to know if you're healthy or not, get a life insurance. because those they will test
They'll
you.
tell you
Yeah, they will
whether
tell
you
you.
qualify or not.
Yes, exactly. And
Oh,
you don't have to
Yeah.
get the life insurance. Just say, okay, I want life insurance, and then you know you have. They say, okay, I can afford it.
so they
But
they know all the answer, right?
they
They
know
know all
all
the
the answers.
questions to
Yeah.
ask you, right?
Yeah.
They look at
Uh-huh.
everything, life
If
insurance.
you're
They
too
look,
sick, they don't wanna. They
they
don't
don't
wanna
want.
give to you
They are the only company who wants you to live longer. They're the
longer.
only
Yeah.
company.
If you're gonna die next year, they don't wanna
No,
insure
they
you.
don't want
They
that.
they lose
Exactly.
money.
You know, and
That's
have
awesome.
have a good
Mhm.
relationship with yourself. That's what it is. You have to get a good
So
relationship
invest
with
into
yourself.
yourself.
Yeah.
No, I fight with myself all the time. So, I said, wake up in the morning. No, 5 more minutes. No, get up
Me
now.
too.
No, 5 more. So,
Well, just be careful what you say to yourself. And and I don't know if it's heavy exercise is good, but light exercise, So I have technique that I do every day. It's like you have to do like from the top to the bottom. First start with your neck, your shoulder, like this and like that, and this and this. Minh chụp vã vía, like that.
mhm,
And then you do from the top all the way to the bottom,
like
like
stretching.
yeah, stretching from top to bottom. And I end up with push up every day. I
So
not a
you're
lot.
doing that right now? Like not
Yes,
right now, but you're still doing it on a
nowadays,
weekly
today,
basis
yeah.
or
Presently, I just start
presently?
doing it again. Sometime in the winter I'm sluggish, but in the summer I pick up again.
Hmm.
So I'm not very consistent with that. It's on and off, on and off. you know, on and off.
I probably do like every day. So
Oh,
I like to run. That's what I do.
yeah, when I was younger, it's like that. And
Yeah.
another trick that people can do is to stay healthy is turn your stomach. When
Uh-huh.
you go.
No, that's only when I'm full.
Do
When I
that.
ate too much, that's what I do.
No, do that.
So,
When I go to the buffet,
is that
Bong.
the
When I
old
go to buffet.
is that the old medicine technique of the Khmer Kai Po?
I think that's Taoist technique.
Kai Po?
Taoist. Taoist.
How is?
Taoist. Do that because in your large intestine there are stuff in there that's 7 years old.
Oh.
Mm-hmm. Yeah.
And that's why
Yeah.
people have colon cancer, polyps, because you exercise everywhere, but not there. That is very important. Health start with there. Mental health start with there too. They say that the
Yeah.
brain, they say you have two brains. One brain sits in here. That's the first brain, and the second brain is up here. So you
Wow.
can take care of the brain.
Did not know that.
Yeah. So
So, yeah, I heard about people having like phù viên ất.
yes,
I don't know how to help that. I don't
Kai,
know
Kai
because,
Pu.
and then a few years later, the person died. It's sad. Phù viên ất.
Kai Pu. You gotta exercise that.
Kai. So Kai.
Yeah,
Okay.
Kai, every morning when
Uh-huh.
you wake up, you go pee, empty your stomach, and then you start your dot
Mhm.
how to Kai to Kai,
Mhm.
as much as you can. Not only
Mhm.
from the bottom, but also side to side. Because now you're
I
hitting the
see.
spleen, just hitting the spleen, the liver. You awaken all those
Mhm.
organs in there.
So that means you don't allow the stomach to be sticky. Like cha cha tha, I
Yeah,
feel my
this
stomach
too,
sticky.
this too,
And then doctor cannot find solution to that. Now I think I know that. I'll tell them, hey, you gotta guide your food all the time.
every morning, every chance you have, you go like that.
Okay.
Yeah,
Uh-huh.
like that. Yeah. And try not to eat a lot. You're not gonna die. Just drink.
Well, the problem of eat moderate, because if you eat too less, you can't have your the food circulate, digest. We're now nanga, so you have to eat just the right amount to keep it
Yeah,
moving. Or it's gonna sit there, and
yeah,
then you have like constipation.
yeah.
So liquid help too
Liquid
to
help.
move that.
But
But
only
if
this
you eat
time,
too much, that's not good either. You
Right.
have the answer for that. So
This
mhm.
guy, it has a lot of benefits. A lot of benefits. Just do that. I don't know what all the benefits are, but it will.
That is something I
Yeah,
learned. This is new to me, and I
yeah.
think it's a good answer.
It's a
Uh-huh.
very good. In the morning, wake up, pee, empty pee. Otherwise, your bladder is full. You're gonna hurt your bladder
Mhm,
like that. So those are a few tricks.
mhm.
So what touch base on mentally, physically, a little bit of emotionally, and also tied it spiritually. Let's move to your financially, Bong. So since we're in that subject, why don't we just focus on from a financially finance stability. Share with us your methodology on why and how you should build generational wealth and plan your own money tree
Okay.
from your own personal experience,
Yes.
or what you have saw out there already. What have you learned? What's available out there?
I think I'm very disappointed with America because the country that is an example to the world is not doing very good to its own people. For example, this retirement thing. People they put it out there stuff so that you think about it. You think it's good, 401k, and then retirement income. When you talk about retirement income, you think about 65 years old. 65 years old. Okay, I'm gonna put it.
67.
67
If
years
you
old. Now,
if you take 65, it's too low. About $100 or $200 less. Wait until
oh,
you're 67.
right. You see, when you talk about retirement income, you talk about that. I
Mhm.
think that's wrong. I kind of know this stuff too late now. I'm teaching my sons, my kids, to do it, and people around me. So you should not be thinking about retirement income. You should be thinking about residual income. Residual income, so that when you have residual income, you don't think about 65. You can retire at 30. You can at 20. I'm teaching my kids to retire at 30. You know, it's up to them to do it, but I will show you the way. So number one is the vocabularies we have, financially, and the education that we have. Don't think about uh, retirement income. Think about residual income. Think about residual income that is most advantageous, especially taxes, because you don't know when you're going to get taxed with the government like this, with our deficit in the trillions and trillions of dollars. And if you look at the history of the taxation, some years they go up to 92%. There's history. Can you believe that? 92% after World War II, I think, 1943 or something like that. And a few times, only came down in 1970. I think the reason it came down is because Nixon, was it Nixon, took the dollars of the gold standard and put it into currency, printing money as much as they want. Now they don't need your money; they can print. That's probably why the tax went down. So now nowadays, because of the dollars being devalued, I think now the world is trying to get what their own currency and all that stuff. I think American dollars become stabilized, so tax definitely going to go up. So you have to look for vehicles that is tax advantage, tax advantage like that. And there's a few of them that can do that. They can do that. There's the private reserve account is one of them. Private reserve account, you know, people think of life insurance. They think that, oh, you have to die to get it, but no, it's not like that anymore. Life insurance solves three problems. Number one, if you die too young. For example, if 30 years old you die, you save in 401k or Roth IRA. In the next day you die, how much you get? Only the amount that you put in. That's it, minus tax. But if you put in a life insurance, you instant wealth. The first payment you pay, you already get that amount. Okay, now let's say that I don't die too soon. I live up until 90 years old. That's live too long. That's not a problem, a human problem. Life insurance, also you can take an income, tax-free income from it. Okay, another problem from human problem is, what if you don't die too soon or you don't live too long, but you get sick, you got disabled, you know, will your 401k pay for that? What if you get sick only for 3 months? Will your 401k pay for that? No, you can access that, you know, and plus tax. But this life insurance, it solved that problem. This life insurance. And also,
How many life insurance out there? I mean, what are the difference between the all different life insurance? Like, I know I heard about IUL or Index Universal Life Insurance. Is that what it
yeah,
is?
yeah, that's what it
So,
is.
is that what it is? It's like I
Yeah.
know there's a lot of different type of insurance, life insurance out there,
Mm-hmm.
but I heard the most is IUL.
That
And
IUL is a must. Like I said,
okay.
you have only this much amount of money to put away, and you have to put in a vehicle that hit all the goals and the most safe, the most growth, you know, like that. And their term and whole, and the term and whole, and then the whole life, you got break down into whole life, index universal. But the one I am promoting is index universal life with living benefits. Living benefits is you don't have to die to use your life insurance. So I steer people to that because it can give you residual income from there, tax-free residual. It's just an income, you know, but the business itself can provide residual income too, because you build your team like that.
Mm-hmm.
But it's a must because it hits so many things. And when when the index goes down, let's say that go to negative 12, your money, though, you don't lose money because there is a floor. Is floor. You don't, when you go down, but when it goes up with it to a cap, you know, cap 9%, whatever it is. But you can buy into it, so there's no cap. It goes up, but if it goes down, it doesn't go down. And also, you can borrow from it. For example, let's say that over 10 years, you save what is it, $300,000 in your account, you know, because there's a max that you can put in, because IRS limit that. So now you have $300,000 in an account, right? If you want to buy a car, you can take the money, borrow from that to buy a car, and then you can pay yourself back. Now you become your own bank. You can pay yourself back, or you don't have to, because but it's just your debt benefit going to decrease. That's all, but you don't have to pay to. So that is the private reserve account. Private reserve account is you have your own private reserve to do what you want, you know, like that. It's very good. So you borrow from yourself, you pay back, you don't have to pay back, you can. And when the money in there, you take it out, you don't have to report it to IRS or anything. There's no report. It's just your money, you know, like that. That's why it's very, very good. It's very good. So especially small kids, when I see small kids, you should see the illustration that we do for small kids. You talk about if they wait until 65 to get it, you talk about $500,000 a year tax free. You know, if you put only 6,000, a small amount, imagine you max it. You know, I have accounts for my sons. They can put $40,000 a year in there. Imagine you become your own bank. You eliminate the bank.
Yeah, I know Monks Ponds in it, you're into it, and then Sai is into it as well, Sapan. And I think there's another Khmer, I think her name is Candy. I think she's also into it as well. Yeah, I definitely need to learn a little bit more about it, and then I need to ask a lot of questions. I know Sam Sek is in it too as well, but I'm always seeking knowledge with a lot of questions.
Yeah.
But the big question I ask is, do you have the patience to accept my question and willingness to answer me?
Absolutely.
Yeah.
Yes.
I mean, I would love to learn more, but sometimes I can overwhelm people with questions and get them annoyed by my question.
No.
So,
We can connect, and then I put you in the right people, and they can talk to you much better than me talking to you. You know, and at the sooner you learn, the better, because it solves so many, Chris.
Yeah, but I don't want to be like, oh, if you want to learn, you got to go to this event. You got to learn this event, and you go to the next event.
No,
next event.
no, no, no,
I
no,
want to
no,
learn
no.
somebody that I can speak to.
Yeah. You can Zoom
meeting.
do the Zoom, and then you learn. And she would put the illustrations. You have questions, she answered like that. More technical than me.
Yeah.
The thing I show you just a little bit, that, but there's so advantageous to this stuff.
Yeah, because I noticed a lot of people get involved. It's more like a referral program. You don't have to know it, but all you have to do is believe in it and refer it, and then somebody else would do the job for you.
Right.
So to me, it's the validation of knowledge. So when I ask somebody a question, they refer me. Like if I call somebody on the phone and they say, "Hey, let me get you another phone to another person," that irritates me as well. And I don't.
I will give you the right person. You don't have to phone tap.
Yeah, and the same thing with this products. If I want to learn, there's always somebody saying, "Hey, you gotta connect to this person." And then another person. I speak to that person, and now I'm not qualified to answer that question. Oh, let me get you connect to another person. And by the time we get to the source, you
don't have time for that. You don't have time for that. Yeah.
I don't have time for that. I need somebody that I can directly, just like when I talk to the facility, I said, "Are you the owner?" If you're not the owner, I don't waste my time talking to that person because I can't make plan with that person. See, does that make sense?
Yes, absolutely.
So I'm always intrigued by this, your product, amazing. And I heard this about life insurance stuff like IUL. It's amazing product. But every time I have a question, I can never go through. I can't get through it. I don't know what
you have
it is.
A question.
Maybe it's me. I don't know. Maybe it's me. I don't know.
we can talk after this. I will text each other after the podcast, and I can connect you with the right, just one person, not two.
Yeah, just one person where I can really have a deep conversation that really get my brain vibrated. Let my brain do its job of analyzing it, observing it, and run through a million scenario if this is going to be effective or not, is this going to be legit or not. So those are the things that I really need to understand, to verify for my own sake of because my reputation is on the line and I can't risk. It doesn't matter if I support you with your products, doesn't matter if I support you with your health and financial education, doesn't matter the life insurance. I need validation because my reputation is on the line because I have people.
Yes, mine too. I mean, it's more important than anything, your reputation.
Yeah, my reputation, because when I like to be known, whatever Chris turned the goal.
Right.
And I like that. I want to be that person. And the only way I can accomplish that is through transparency, through honesty, through reliability, through dependability, and take accountability. If I make a mistake, I tell you, I'm sorry, this happened. Here's how I'm going to fix it. That would never happen again. And that's how I build my reputation from a business perspective, from a personal perspective. As you can see, I show a lot of love, a lot of kindness, compassion, understanding, and accepting. Learn how to accept people for who they are, for what they do, and be respectful. And I have an understanding that I don't understand everything. Right. Just like I don't understand about life insurance. I don't understand about your products you're promoting, but I'm going to ask you a question because I'm interested.
Yeah. When I was working, I thought about this podcast and I thought about you.
Yes.
Chris, a few things came up to my mind. Number one is you are very smart and you know how to put, like, people random say stuff all over the place, but you put them in order. You are very smart and you are very genuine person, and you are genuine and you have a good heart to help people just for helping people's sake. You don't want to cheat anybody, anything like that.
No, I do not. I do not. Just like with the soccer program I'm doing now, like 100% of my profit that I get from player is donated back to them, 100%. Right. And I tell them, I said, look, I don't make money from you, but let me tell you how I make my money. 8 different
Right.
ways I make my money. So when I go out there, I make my money. I know when I sit down with the facility, if you go to them, they're going to charge you X amount of money. But if I go to them, I pay them up front, I'm going to get less amount per hour. So,
Right.
and then by the time I add my investment percentage to it, the 25% return investment to it, it's still lower. The cost for you is still lower than if you were to go directly. So
Right.
that's the one way I can make my money.
Right.
Then I go into the second, the third, the fourth, the fifth, the sixth, the seventh, the eighth. And that's how I explain to them. It's like, oh, I never know that. I always thought that you charge us $20, and what do you do with those money? You know, like you're making all this money. I said, no, that's where the cash prize comes in. You know, I don't have to give you
Transparent.
cash prize. Yeah,
Very transparent. Yeah.
yeah. I told them you have access to my financial spreadsheet on Google Share. You know, I said you can look at it anytime you want, and you have any question, give me a call. And that's how I build trust. That's being transparency. And
Right.
also, whatever I do, I'm very reliable. So when I said there's a pickup, it will happen. If I said there's a game, there are always going to be people showing up to play. Because a lot of time, people have a pickup, they show up, nobody there. Sometimes they go to a game, the other team didn't show up, or the referee didn't show up, or the facility's closed, right? Because they're not organized, they're not structured, they don't validate everything. I validate it constantly. So
Yeah.
that's what make me. So if I decided to support you from the perspective of your products, perspective of your life insurance, the financial insurance, the life insurance, yeah. But once you get me on board and you have my respect and my understanding, I think I can really help restructure of how to get a better result.
Absolutely.
Yeah.
And my question for you is, how can I get your support? What do you need?
I'm sorry?
How do I get your support? What do you need?
It's very simple. It's very simple. Like I said, I want to learn more about the IUL.
Okay.
I'm having a hard time honestly, I get annoyed easily. If I ask somebody this question and they don't know it, and then they try to make it up, that's annoying the heck out of me.
Right.
Or they don't qualify of the products and they try to sell it and then try to escape from it and not being transparent and not being genuine.
Right.
And then they refer me to the next person, and the next person do the same, and the next person do the same.
Right.
It irritates the crap out of me, and then I lose interest. And once I lose interest, I don't want nothing to do with it.
I'm the same with you. Yeah.
Yeah. So, but once you have my attention, you have my respect, I will fully meet and exceed your expectation. I'll make sure, because things in my head run through my mind a million times before I even able to spit it out. And I'm gifted with the 4-time amount of faster than most people. I don't know what it is. So I know that's what I noticed since I was little. You know, I noticed that I was able to do things much quicker. So, but anyway, so let's go ahead and talk about people a little bit, Bong. And then this would be my last question for you. And then we're going to go ahead and close down to conclude our podcast. So let's talk about a little bit about, you know, how and why it is important to be happier with the people around you, and how is it to have a strong inner circle relationship? Why is it so important to you?
Yeah. To be happy with people around you, first you must be happy with yourself. You know, it radiates out of you, you know, so build you, and you have to have an honest review of yourself, you know. And if you do stuff, even it might be people might look at you, you know, there's a good guy, but in your bathroom, what did you do? You know, in your private room, what did you do? In the car, what did you do? And that will affect you. So you have to be, you know, there is a word called holy. You know what holy is? Holy is to be one. You're like, you know, like Borisot, Kamaita Borisot, right? Holy is to be one, you know. Holy is to be one. You are a holy person, you are one person. When you go over there, you are Robert. When you go over there, you are Robert. When you go over there, you're in a pharmacy, you're Robert. When you are doing a seer, you are Robert. So you have to be that holy person, that one person. And then you don't have a judgment on yourself, with negative judgment on yourself, that will radiate to other people. Then you're gonna see other people the way you see yourself. You're gonna see the people yourself, and then that's when you don't have happiness. When you always be suspicious of people because you are a very dishonest person. You think everybody's like you.
Yes,
So,
usually it manifests to what your thought process are, right?
yeah. So you have to be that right person to yourself. That
So the
will be.
key point for you is you got to know yourself. Look at the guy in the mirror. If you're happy, usually people see your energy, recognize your energy, and that would reflect to them, and they also become happy and genuine to you as well. Is that what you're saying?
You reflect, but you don't judge people according to your guiltiness.
Mm-hmm.
Your guiltiness. You judge people. You see people better. When you see yourself better, you see people better.
I
That'll
see.
be
How do you? So we passed that stage. How do I build a strong relationship with other people? So what advice would you, based on your own experience, how to have a strong inner circle of relationship? How do you build that and maintain it?
There is something called impression of increase. Impression increase. So impression increase is that you want to increase the person. You don't want to decrease them. Whatever you do, you want to build them up. Build the person up. Construction, not destruction. And you have to spend time with them. Spend time with them. But nowadays, not talk about like texting stuff, but actually face to face where we can smell each other.
Having coffee, having
coffee
breakfast,
like that.
lunch. Okay.
Be honest with each other.
Right.
Yeah.
Just spending time.
Yeah. Be spend time and be vulnerable, be humble, like you said. Be humble. You be humble like that. Nobody wants to be next to an arrogant guy. It's always me. Even
I think one of the biggest problems we have as humanity is ego.
Ego. Yeah.
Yeah. Right.
Yes, that's true.
I think that's one of the biggest, because it costs us. Yes, ego is our worst enemy, right?
Yes.
I think there should be a meaning what E stand for and G stand for and O stand for.
Yes,
I think have to be. They're gonna come up with that one. I think that's what really hurt humanity, when we think of ourselves invincible, think ourselves that we're better than other people, think ourselves, because in every snap of your finger, situation could change, circumstance can change, your luck could change, because from you being healthy, you could be in the hospital.
Yes.
You can't.
Instant.
Yeah, and then
you could lose everything like this.
Yep. You can't have that ego, because in the situation right now, you might be better than me, or I'm better than another person better than another person, and we don't give each other the time to really get to know that person from a personal level.
Humble and vulnerable.
Yes.
Vulnerable.
Yeah, just be genuine. I think
genuine, yes.
I enjoy. I think I was blessed to have a church family that adopted me, sponsor, and then also adopted me into their family personally, and to carry the family name. I was blessed to have that, and not too many people
sponsor me also.
They I think that's one thing they teach me, is to be humble. Sometimes when they want to say, remind me, they say, I think I created a monster. I know what they mean by when they say, I think I created a monster. When they tell me that clue, that means I'm overconfident. So every time we at the dinner table, she go, I think we just create a son that are becoming a monster. So they're telling me to humble myself. So I think that's, but you know what, at my table, at dinner table, I know that I am full with full of an inner circle relationship. That's why it's important. That's what I share with you is I can't wait to spend time with them, having dinner, having breakfast, or having a conversation with them. That's what it is about sport, or it's about engineering, or about life in general, or maybe even about Donald Trump, who knows? or Biden, or Joe Biden, right? Whatever the current situation would be, right?
The world.
So, or about the world. So that's genuine because, you know, we just talk about it. We don't really judge each other. We just discuss and talk and, you know, what's going on. So, but anyway, Bong, I know we passed our deadline a little bit as usual. I can never reach that 60-minute, believe me. It's so much conversation, so much to say, so much to share. So I want to say thank you so much for taking the time to share your knowledge with us, and I hope that our audience would take this and learn it from us, learn it from you, and would help them, you know, take it to the next level, whatever they need to learn, whatever they need to gain from you.
Well,
I think you have a lot of good information.
Thank you also, Chris, for having me on this podcast. You know, the more I spend time with you, the more I grow to love you.
Thank you so much, Bong. I appreciate it. Thank you so much. Yeah.
I had to
be. I don't know about Whoopi, but you.
Yeah. I have to be on a break for 15 minutes. Yeah. So, I was listening, watching,
yes.
but I'm here. Yeah. So, about the ego, and because in Buddhism we were taught to know the self, know yourself. When you know yourself, you know who you are, and then learn about other people. It's a really difficult process. Once you know yourself, it's easier to work with other people. And so ego is just another thing that people need to learn to discipline themselves. Yeah, that's and everyone. Everybody need to work on their, disciplining themselves to fit with the society and with other people around them. You can never really satisfy anybody because sometimes, they have their mood swings, sometimes they're happy. So you have to kind of know how to deal with people being happy. Well, people that angry, you have to know how to deal with them too. In order to be able to deal with them, you have to really know yourself, your characters, and everything. So that's in Buddhism philosophy, and yeah, that's something I want to share, that we should dig deep into it, that that won't be a problem in uniting our Khmer people.
Yes.
Yeah, I can add to that, Robert. I could say to myself, mission accomplished, because I do truthfully live up to my business trait and my personal trait.
Yeah.
So just to have you as a new person trying to explain to you what we do with the Kabami, what we're doing with the podcasting, what is our ultimate vision, what we're trying to do is with the 802 of rebirth and rebuild Khmer Empire. I think for you to say that to me is a validation and certification of that I'm on the right path. To if I can change the mindset of one particular Khmer, my mission is accomplished. So start from Bopia, the first one, to Princess Rita, to Sapan, to Bong Sapan, to through Satya, through many other that I didn't get a chance to mention yet. So due to the fact that sometimes they don't just want to be private, confidential, private, they like to be private. And
right.
But just to hear from you, because we have a dream, but I believe in action. I don't want you to just keep watching me. I want you to be in the middle of the action. So we wanted to do something great together, to do something better, something big, better than ourselves. So to have you that, and I'd like you to continue taking action with me. I will continue to talk to you as often as I can, so that we can, the more vision I share with you, the more mission, plan of action But now we have to take action.
Yes.
Don't just talk about it. And I have a few that love to watch. They believe, but they just want to sit there and watch what's going on. And, you know, and I'm okay with it too. But I need my people to not only believe in the vision, the plan of action, but actually start implementing, executing it.
Right.
So I'm happy to hear that from you, Bong. And I can't wait to do a lot of action with you. Take the
And thank you for being here and share your story. That taking action, being present is very important. Being non-present, it's like non-life. So
Yeah.
what you're doing is very important. And I've been doing that. I was a really shy person. Well, I'm very shy, and people thought they were, even my old teacher, my Khmer teacher, was amazed that I stepped up like from being shy to a shining star. And it's like, wow, because I didn't sit around. I took action. I stepped up. And I wasn't afraid because I went through like suicidal. It's like either, I sit here and die or I step up. So I chose to step up. That's why I'm out here. I'm not a really person who likes camera either, but I'm here, do my best smiling. I
Yeah.
am not a good interviewer, but I like asking questions, make you happy. I love to make people happy, put a smile on your face. Yeah, so, and we're both like have something in common there, which is really good. Thank you for stepping up.
No problem. Thank
yeah,
you.
we need more Khmer people like you, Bong. If you know somebody that have a business, that love to start their own business and really believe in themselves and believe that they can rise, they can thrive, and they can conquer. If they just believe in that themselves, with that, I think as a Kabami group, we can help each other, support and invest in each other. So I think let's continue doing this.
I will connect. I come to mind right now at least one Khmer person who is a restaurant owner
Yes.
in downtown in Lebanon. So I will connect her with you. She's very good.
Yeah, and once I get the package design done, once I get the packaging manufacturer negotiated and the website, it's two parties, website as well as an app. Okay.
Right.
So once that is done, that's when we present the website, the package to the restaurant owner. And then once they believe into the vision, what we want to do, then's when we going to accept them as our producer.
Okay.
And once we have 10 producers, then we go out there and ask 5 restaurants to come and order from us from that one particular restaurant. So,
okay.
All right, Bob. So anyway, let me just go ahead and end this, and then you can stay on if you wish to talk to me a little bit more. Oh, I think she want to come back on. Give me one second. Oh no! What? How do I? Wait. No. Okay. How did I do that? Oh, I don't know what happened there. Okay, she's back on. Okay. So anyway, let's just go ahead and end this podcast, and then you can stay on and talk some more, Bong.
Okay.
If you wish. If you have to go, you can also go as well. So let me go ahead and end this real quick. Okay, Bong?
Yes.